Continue to follow breaking news this morning. Federal health agencies calling for an immediate pause of the Johnson & Johnson vaccine because of 6 recipients in the United States developing a rare disorder involving blood clots within 2 weeks of vaccination. So they are recommending that. We want to bring in right now our state the Washington State Secretary of Health, Dr. Umair Shah, to talk about all of this morning. We want to talk, first of all, Dr. Shah, about the Johnson & Johnson vaccine. Federal health agencies recommending that states pause administering the Johnson & Johnson vaccine. Will that be the case here?
First of all, thanks for having me. Absolutely. That's what we're doing right now is we're pausing, we're holding off. And I want to make sure that everybody recognizes it's not a stop. As you said, these are extremely rare events. But what we have been saying to the public throughout the vaccination process, anytime we had something that was of concern, we were going to be as transparent as a system to be able to get that information out. And that's what the federal government's done. So we applaud them for that effort.
How devastating will this be for the vaccine rollout statewide?
There are a couple of things that I would say. First of all, I don't think it's going to be devastating because J&J has been such a small a percentage, if you will, of our vaccine supply. It's really been Moderna and Pfizer. It's been the vast majority, I would say 90% of our vaccine supply has been those 2 vaccines, if not more. And so I think from that standpoint, supply-wise, it's not going to be devastating. We were already expecting, remember, there were some production issues a couple of weeks back. We were already expecting a lower number of doses that were going to be coming into the state. So from that standpoint, I think it's okay. But one concern that I have, obviously, is I don't want the message to go out that vaccines are not safe or they're not effective. And from that standpoint, we need to all make sure that we put this all in context. Again, 6.8 million vaccines were administered with J&J, and only 6 cases of this rare blood clot has been reported. Again, it's a pause, not a stop. So we just need to keep the context in mind.
Okay, now that we have you here, want to talk about the rollbacks that are going into effect on Friday. How necessary was it to put Pierce, Cowlitz, and Whitman counties back into phase 2 of reopening?
Well, as you know, Governor Inslee was very clear that, we are moving forward. We're moving forward with extreme caution. We're monitoring what's happening. And that's where everybody was moved into phase 3. And then we were also going to continue to reevaluate what those metrics were to see if people could stay, counties could stay in phase 3. It turns out that we also modified some of the not the metrics themselves, but the fact that you had to not be able to it wasn't an either. You had to fail both metrics, both in terms of cases and the hospitalizations metric together in order to move back. So 3 counties didn't. And, from that standpoint, I would say that we want to continue to work with them. We want to do everything we can to support them. Obviously, we want to see all of our counties continue to move forward, but we want to make sure that if there is a health and safety issue, that we certainly have to take that into consideration and be very strong about it. And that's what Governor Inslee did.
And we know that, King County, Snohomish County are on the verge at this point. I mean, do you foresee other counties needing to go back into phase 2, especially considering how many people are getting vaccinated right now?
Right. So a couple of things. I think you brought up a good point. First of all, is that we're reevaluating every 3 weeks. So I think there's a piece of that. Now, counties obviously have an ability to roll themselves back if they feel that, within that 3 weeks, there's still something not right, or they feel like they need to be more restrictive. They can certainly roll themselves back. But from a state standpoint, we're going to be relooking this in 3 weeks. But what I want to just emphasize is what you said, is that vaccines are the path to the future. And while, again, the news from earlier with the J&J vaccine gives pause or caution, that is the path forward for us, is from the vaccination process. And the good news is that we've vaccinated so many people across the state of Washington. We've now administered 4+ million doses of vaccine into the arms of Washingtonians. So I think we're making progress, But again, it's a race against time. And these variants are concerning to us. Obviously, when you see case rates going up, hospitalizations taking a pause, or they're starting to increase. And in addition to that, you're racing against that with vaccines. There's a lot that's complicated here. But again, we're trying to sort all that through so we can make it easier for people to understand.
Is there a certain age group, a certain behavior that is causing the increase in infection rates? And what message overall do you have for folks today?
Well, my message to everybody is don't hesitate, vaccinate, right? If you are eligible, and guess what? On the 15th, we're calling it affectionately Vax Day, not Tax Day, right? It's a couple of days from now, where all Washingtonians 16 and older are going to be eligible for the vaccine. We have been seeing, obviously, that seniors previously were the majority of what were going into the hospitals and things of that nature. And now we're seeing that it's a younger population. Why? Probably because people are out mixing and doing things, but also because they've not been eligible for vaccines. So that's going to change starting in a couple of days, which is fantastic news. However, we're in this together. And what I've been saying to everybody is we are not out of the pandemic until we are out of the pandemic. So let's not act like there is no pandemic going on. Wear your masks, wash your hands, watch your distance, get tested if you need to, get vaccinated when you're ready or eligible or it's offered. And guess what? The message is when these things are all done together, we are going to be able to drive this virus into the ground, but we cannot let up. And I think that's the key message.
There you go. All right, Dr. Umair Shah, thank you so much for taking your time to join us this morning. And thank you for your work in helping us fight this pandemic. We appreciate you.
Really appreciate you too. Thank you so much.
All right.